Hi, I'm Dr. Usmani here at Delaware Smile Center, and today we're going to talk about tooth decay, and I'm going to try to answer some of the most common questions regarding tooth decay. So let's go. So tooth decay in its most basic form is basically rotting of the tooth. It's where bacteria attacks our tooth surface and begins to eat away at that structure and starts to destroy what we know as our tooth. Bacteria is the source of dental decay, so lack of good hygiene, not brushing, not flossing properly, leaves food particles on the tooth, which bacteria is attracted to. And that, in combination with the right type of proteins and nutrients there, allows bacteria to eat away at the tooth structure. So signs of tooth decay can vary. I mean, sometimes as you're brushing, you can maybe, or you're looking inside your mouth, you may notice a dark spot, a dark area that doesn't seem to go away. Other times it can be a sensitive tooth. Maybe you drink something cold and you get a little zing, or you have something sweet, and that also triggers some tooth discomfort. So those are all some signs that you may possibly have tooth decay. So the effects of tooth decay, if you leave that decay on the tooth and you don't treat that decay is going to spread. It's going to spread to other teeth. It's going to invade more of the tooth structure and work its way closer to the nerve, which can be quite problematic. As that decay progresses towards the nerve, if it gets into the nerve, it can cause an infection. It can cause an abscess that can be quite painful. Sometimes those situations can land you in a hospital. So we certainly want to try to avoid that, or the intense discomfort. If you wind up getting nerve pain, it can keep you up at night. And oftentimes patients will describe intense levels of pain. So tooth decay can cause certainly all of that. It can lead to tooth loss also. So if you have multiple untreated areas, you can wind up losing teeth as well. So it's a serious disease. And oftentimes the early warning signs, if we take advantage of them, we can stop it and prevent it. On its own, no, usually not. There are certain situations, and for this, you definitely have to come and see your dentist. But if the decay is caught very, very early, we can use concentrated forms of fluoride to help stop that decay in its tracks and prevent it from spreading further. Other times we try to be conservative with our treatment choices, and when we see decay starting to happen early, we want to treat it early because that will reduce the amount of tooth structure that needs to be removed and treat it with a filling. If we treat it with a filling, it can stop that decay, if the decay is removed and it doesn't progress any further. But the idea is to catch things early so they don't get large. If we think of the tooth in terms of layers, the outer layer of your tooth is enamel. It's a very thin layer, but it is a very strong layer. So when that decay actually penetrates and goes through that outer layer, and it's into the second layer of tooth called dentin, that's the point it's irreversible. And now when it gets into the dentin, it's about 10 to 15 times. The dentin itself is 10 to 15 times weaker than the enamel. So now that decay that's penetrated through the enamel will spread very rapidly through the dentin. So in terms of catching it, we want to get it, at those early stages so you don't wind up having further problems. But once it hits a dentin, it is irreversible. So as I mentioned earlier, the most basic form of treatment is a filling. So the decay portion is removed from the tooth. And in place of that, we do use white colored tooth material that is bonded into the tooth and blended in very naturally so it looks just like your normal tooth. Excellent oral hygiene, watching your nutrition, when do you snack, when do you, how often are you brushing your teeth? So just to answer a couple of those things, we want to avoid the real sugary, sticky snacks. One that always comes to my mind when I'm talking to kids is our gummy snacks. But sometimes things that we think are ordinarily healthy also, raisins, for example. They're high in sugar content as well, and they tend to be sticky on the teeth. So we want to make sure that we're brushing after those treats, if you will, and that we're keeping our mouths as clean as possible. So just reducing the amount of snacking that you do, limiting your meals to the appropriate meal times, and then observing good hygiene. Make sure you're brushing, make sure you're flossing at least twice a day, I would suggest, at night and in the morning. And if you can, midday would be great. Tooth decay can be painful. Some of the early symptoms, they may not be super painful, but more annoyances. But as the decay progresses further and gets closer to the nerve, it can be extremely painful. And I've had patients, female patients, describe to me that tooth pain has been worse than bearing children. So I would take that pain level very seriously. So in terms of treating tooth decay, you should see your dentist regularly. As I mentioned, sometimes decay can go unnoticed for quite some time, and you don't want that to happen. Not everybody will get those early warning signs of sensitivity and symptoms. So the best way is for regular visits to your dentist, where we can monitor and screen that and identify decay at its earliest possible stages. So if you have any concerns about tooth decay, or it's been some time that you've been to the dentist, please don't hesitate to contact us here at Delaware Smile Center, 302-285-7645. Call, come in, get your consultation examination. Let's find out if there is decay so we can take some early steps to stop that from getting worse for you. Thank you.